What are two types of knee surgeries? There are basically closed knee surgeries and open knee surgeries. In closed knee surgeries, surgeries are arthroscopic knee surgeries, which consists of introduction of a camera through a small portal in the knee joint and repair of meniscus, cartilage, ligaments with the use of arthroscopic and endoscopic technique. This surgery is a minimally invasive surgery without opening the joint. The other type of surgeries are open surgeries where a cut is taken in the front of the knee joint is opened and either one side of the knee or both the sides of knee are replaced. The other open surgeries of the knee are osteotomies of the knee where correction of the deformities are done by cutting the bone and putting a plate, cutting the bone and putting a plate. Other open knee surgeries are fixation of fracture. Thank you.